Say goodbye to painful arthritis and take control of your life in this video. Discover proven tips to manage arthritis, reduce pain, and improve your quality of life. Don't miss out. Watch now to learn everything you need to know about beating arthritis naturally. Millions of people are suffering from arthritis, and it is the most common cause of disability. Although it is common to older people, it can also affect young adults and children. Arthritis is a condition that affects the joints and its surrounding tissues, and there are more than 100 types of arthritis. This condition puts limitations in one's ability to accomplish daily physical activities, making it a very disabling condition. Due to the pain of inflamed joints and surrounding tissues, people with arthritis are unable to function normally in their everyday lives. Living a life with limited mobility can be very frustrating and depressing. If you are one of those people suffering from painful arthritis, you probably want to achieve arthritis freedom as soon as possible to improve the quality of your life. The following tips can be very helpful to stop the pain and achieve arthritis freedom. Consult your doctor. Early diagnosis, management, and treatment can save you from serious complications and costly hospitalizations. Learning to manage arthritis as early as possible can also help you function better. Not to mention that it can be a symptom of a disease, so it is important to see your doctor to evaluate your overall health condition. If left untreated, arthritis can become a chronic problem that can torment you for the rest of your life. If you really want to achieve arthritis freedom, seek professional help. Learn self-management. Arthritis can affect one's quality of life, so it is important to learn how to manage your arthritis to improve the quality of your life and achieve arthritis freedom. Participate in arthritis self-management program in your area to learn how to cope with arthritis and lessen its negative effects in your daily life. There are various ways and techniques to cope with arthritis, and with the help of people who are experts in dealing with arthritis, you can manage your arthritis and live your life normally. Do not hesitate to ask help, because arthritis is a manageable and treatable condition if you seek treatment and act as early as possible. Stay physically active. Lack of joint movement can worsen your arthritis, so it is important to stay physically active to achieve arthritis freedom. Idleness or sedentary lifestyle doubles the risk of developing arthritis due to inactivity and lack of joint movement. Don't be a couch potato. Limit your TV watching or computer usage and engage in more physically active activities and hobbies. Moderate regular physical activities like walking and swimming can be very beneficial for people with arthritis. If you have severe arthritis, it is important to ask your doctor or health provider about the best exercises applicable for your condition. But bottom line, an active life can save you from the disability brought by arthritis. Lose weight. Obesity increases the risk of people in developing arthritis, diabetes, heart disease, and hypertension. For people with arthritis, maintaining a healthy weight can prevent the progression of arthritis. A healthy weight reduces the risk of people from developing arthritis and helps people suffering from arthritis to lessen the symptoms and function better in their daily lives. A weight loss program can be very helpful for you to maintain an ideal weight. Losing weight is measured in small successes and often frustrating, but you need to remind yourself that you need patience and dedication to achieve your ideal weight and eventually achieve arthritis freedom. Eat a healthy, well-balanced diet. Diet plays an important role in managing arthritis. The kind of diet you follow could influence the occurrence of arthritis. Because there are various types of arthritis, no single diet plan will work on everyone, but following a diet based on moderation, balance, and variety could be very beneficial to your arthritis. Eating foods good for your arthritis will help you achieve arthritis freedom. Eat more fish to get more omega-3 fatty acid, which is beneficial in healing joint inflammation. Avoid red meat because it promotes inflammation leading to arthritis. Eat fish as a replacement for red meat. Cut down on fats. Avoid foods rich in saturated fats and avoid processed foods. Eating a healthy, well-balanced diet is not only good for your arthritis but also to your overall health. Avoid smoking. We all know that smoking is not good for our health, especially on the lungs, but there are studies stating that smoking intensifies the inflammation levels of the body, thus increasing the risk of smokers in developing arthritis. You also have to know that inflammation is the underlying cause of arthritis. Avoid smoking if you want to achieve arthritis freedom. Nicotine, which is the main substance found in cigarettes, is not only bad for arthritis, but it is also not good for your overall health. Save your lungs and stop the progression of your arthritis by avoiding smoking. Protect your joints. As mentioned earlier, arthritis affects the joints, and if you want to achieve arthritis freedom, you have to protect your joints. Avoid activities that will hurt and stress your joints. Having a job with repetitive motion puts a lot of stress on the joints. If it is possible, avoid stress and repetitive motion. Balance physical activities with rest. Be careful with your everyday tasks and accomplish your tasks in ways that will not stress your joint. Arthritis is a horrible disease which causes pain to the joints in the body. When I say joints, I mean all those areas in our bodies where two bones combine, such as wrists, elbows, knees, shoulder or hip, which allow us to be mobile. As we age, our bodies are worn down, and damage is caused to these joints, thereby weakening them and causing the person to suffer due to pain and stiffness, less movement, instability and physical deformation. To help combat these issues, natural arthritis pain relief can be given to the patients. Understanding arthritis. As people age, they naturally grow weak and a significant damage occurs to their bones and joints, which results in pain and stiffness. The term arthritis is used to signify the pain and ache in muscles, bones and joints. The effect of arthritis pain on the lives of those suffering from it is huge, making it extremely difficult for them to move, and therefore without any natural arthritis pain relief they are unable to perform the most mundane of tasks done every day. People suffering for arthritis and other bone problems such as osteoarthritis, rheumatoid arthritis or any other arthritis symptoms will find it a hurdle to perform simple tasks such as walking, driving, brushing their teeth or even using a computer. When we think of arthritis patient, most of the time an old person will cross our mind, but that's not always the case. Even though this disease is mostly common in people over 60 years of age, it is found in groups of all ages, including children and infants. That's why most people prefer a natural arthritis pain relief as opposed to pharmaceutical medication with heavy chemical doses. At times, arthritis gets confused with a similar disease called rheumatism. However, there are a few differences which most people don't realize. Rheumatism affects the muscles, tendons, cartilages and ligaments besides affecting joints. Along with this, internal body areas are also affected by this disease. Therefore, taking a natural arthritis pain relief is of the utmost importance. Types of arthritis. Arthritis has many different forms, where pain occurs not only to a person's joints but other areas as well, including skin, chest, eyes, lungs, kidneys or anywhere else on the body. There are over 100 different kind of medical conditions related to arthritis, for all of which, a natural arthritis pain relief is available. Out of these types, the two most common ones are rheumatoid arthritis and osteoarthritis. I'll provide brief explanations on them. Rheumatoid arthritis. This type of arthritis causes inflammation of the joints. It's a type of autoimmune condition which means that it affects our body's defense system from functioning properly. Rheumatoid arthritis is the result of the body's immune system attacking the joint lining, causes it to break down and become inflamed. Not only does this affect joints and bones, but body organs are also not spared. The most common limbs attacked by rheumatoid arthritis are hands and feet. Women tend to get this serious condition more than men. Osteoarthritis. This form of arthritis occurs when joint cartilage is lost due to wear and tear. Osteoarthritis is mostly a result of old age and directly affects the joints of hips, knees and fingers. Other types include gout, lupus, juvenile arthritis, arthritis in children, viral hepatitis, liver, ankylosing spondylitis, spine, scleroderma, skin, and fibromyalgia, muscles. Arthritis symptoms. A patient is diagnosed with arthritis when they complain of any type of arthritis pain such as joint pain, joint stiffness, inflammation or swelling. Inflamed joints will have a red hue and appear to be tender, while feeling warm on touching. Besides this, patients will also experience insomnia, fatigue, depression and muscle pains. The symptoms of this disease may appear gradually over time or suddenly at once. Doctors perform various tests, including X-rays and blood tests to acknowledge the extent and type of arthritis. Once the severity of the condition is known, A natural arthritis pain relief is recommended to help combat the disease. Arthritis causes. The most common factors leading to arthritis pain are age, genetics, being overweight, deficiencies in nutrition, joint trauma or stress, immune or metabolic disorders, and occupational hazards such as jobs involving heavy construction. Arthritis treatment. There are many conventional drugs that can bring down arthritis pain, but most of them have serious side effects. And since arthritis is such a condition that its medication is taken over a long period of time, most patients prefer drugs that are more natural since they don't have any negative effects on the patients. More and more doctors are now also referring their patients to natural arthritis pain relief. When I talk about an arthritis diet, I am referring to a specialized diet that a dietitian or nutritionist has worked out for your specific case of arthritis. There really is no one elite diet that will apply to all arthritis sufferers, so I will just refer to some common trends in these typical arthritis diets. In a nutshell, to fight arthritis, the best diet is one that is high in vitamins and minerals with sufficient good quality protein. Your carbohydrate intake should be from low GI sources and limited in fast-releasing sugar. Your fat intake should be low overall, yet consuming unsaturated fatty food is essential in an arthritis diet. Limiting food that you are allergic to can prevent an inflammatory response by the body. Foods that irritate the digestive tract and hinder detoxification should be avoided. Typically, these are foods containing gluten or dairy. To get the best result for your specific case, getting a dietitian to work out a plan for your arthritis diet is a good idea. A good, well-balanced diet is important for general health, but it becomes especially important if you have arthritis. Often people will need increased amounts of certain nutrients when they have arthritis. A healthy diet is strongly linked to a strong immune system. A strong immune system gives you an advantage for fighting any disease, especially inflammatory and autoimmune diseases like arthritis. You can either consume more whole, fresh foods containing these nutrients, or you can use good quality supplements to make up the shortfall. Most of the current research doesn't really make any strong connection between your diet as cause, or as a way of treating arthritis. Many people, however, believe that certain foods can ease inflammation and swelling, while others avoid certain foods that may trigger a flare-up. As a general guide, anyone should eat a diet rich in oily fish, low-fat dairy, unless have lactose intolerance, fresh fruit and vegetables. Greasy, fried foods should be avoided as much as possible. Foods containing lots of refined sugar is not healthy and could lead to many health conditions. There are many claims, especially for different sources on the internet, about certain foods and arthritis diets that will cure arthritis. There is little evidence of one specific food provoking or calming arthritis symptoms, except when you are allergic to that food type. Mostly these claims are linked to some kind of commercial benefit for the companies involved. It is, however, true that specific, goal-oriented supplementation can hold benefits for arthritis. The other key aspect is to make your eating habits a part of your daily life. You should budget time and energy to buy the right foods and plan what you are going to eat every day. If we don't plan, it is so easy to resort to fast food or processed foods. Here are some healthy arthritis diet basics for arthritis sufferers. Healthy arthritis diet. The key to a healthy arthritis diet is variety, balance, and moderation. A variety of low GI carbohydrates, low-fat proteins, and fresh fruit and vegetables are universal diet basics that all people should follow. So basically, you need carbohydrates, protein, vitamins, and minerals in the right proportions for your arthritis diet. Carbohydrates. Lately, there has been a lot of literature about the weight loss benefits of low-carbohydrate diets. You definitely do not want to go this route if you have arthritis. Carbohydrates are the best source of sustained energy, feeding your body with the calories it needs to stay healthy and fight infection and disease. Carbohydrates like bread, rice, pasta, and potatoes contain fiber, essential in helping the body to stay regular and remove toxins from the bowel. Carbohydrates also contain nutrients like calcium, iron, and the vitamin B group. Carbohydrates should ideally make up a third of the total calories that we consume. This means that you should consume about 6 to 14 portions a day, choosing as many whole grain varieties as possible. As an example, one slice of bread, 3 tablespoons of cereal or a bread roll will constitute 1 portion. Carbohydrates high in fiber and with a low GI are beneficial because they make you feel fuller for longer and does not spike blood sugar levels. The high fiber varieties are more bulky, so they take up more space in the stomach, making you feel full. This means foods like pastries, biscuits, sweets and too much sugar in your tea and coffee is not healthy and places pressure on the body to process. Protein. Eating enough protein is essential, keeping every single tissue in your body healthy. Protein is found in your organs, bones, muscles and skin. The whole body is made up of about 25% protein. Amino acids are the building blocks of protein. There are about 25 different amino acids, 8 of which are essential. This means that the body cannot function without them. The others can be made from these 8. Good sources of protein are fish, chicken, eggs, red meat, dairy products, beans, nuts, seeds, lentils and tofu. These all have about 10 grams of protein per 100 grams, 10% protein. This means that if you eat enough calories from quality sources, you are likely getting enough protein. In fact, most modern sources say that even if you are strictly vegetarian, you will get all the amino acids you need to stay healthy. However, you would have to eat a varied, healthy diet. These sources also contain the B vitamin group, zinc and iron. Are you getting enough protein for your arthritis diet? You typically need about 2 portions of good quality protein daily to keep you healthy. These portions can come from meat or vegetarian sources. Keep lean meat down to 4 times a week and try to have fish at least 4 times a week. The other portions can be made up of foods like soya, tofu and beans. This amount of protein should roughly equate to about 10% of your daily caloric intake. The World Health Organization recommends 10%, which is roughly about 35 grams of protein. A portion is about 100 grams of whatever source you choose. Since protein makes you feel full quickly, some diets prescribe a lot of protein-rich foods and cut out carbohydrates almost totally. This leads to a loss in muscle tissue, something that you really don't want if you have osteoarthritis. This is because your body needs the energy from carbohydrates to feed muscle tissues. People suffering from osteoarthritis need good muscle tone around the joint. So diets that promote high protein intake can be toxic to the body and lead to a reduction in muscle mass. Fats and oils. Contrary to what some sources might suggest, fat is an essential part of a healthy diet and especially for an arthritis diet. It provides a lot of energy and helps the body to absorb vitamins. We typically need about 25 grams of fat per day. The typical Western diet is unfortunately packed with fat, way too much than what our bodies actually need. The benefits of a low-fat diet stretches beyond weight reduction, which will improve symptoms in the long term. Patients cutting down on fat intake feel rapid relief from symptoms. There are, however, 2 types of fat, one good for you, and the other unhealthy in high levels. Saturated fat, found in red meat, butter, cakes, pastry, and most vegetable oils are unhealthy because they lead to high cholesterol, high triglyceride levels and most importantly, high homocysteine levels. This has been linked to heart disease, diabetes and other conditions. Homocysteine levels can be lowered by following the guidelines of an arthritis diet and by vitamin B complex. Saturated fats block the conversion of the essential, good, fats from being used to lower inflammation in the body. They also hold bad news for those who want to lose weight. Calories from saturated fat are more efficiently stored as fat in the body compared to calories from proteins and carbohydrates. These bad fats should be scarce in your arthritis diet. On the other hand, unsaturated fats, found in olive oil, oily fish, nuts, avocados and some margarines have long lists of health benefits. People consuming olive oil every day are less likely to develop rheumatoid arthritis. They are good for fighting heart disease, lowering cholesterol and homocysteine and may actually reduce inflammation levels in the body. The ideal arthritis diet is one that is very low in saturated fat and sufficient in essential fats. A vegan diet, one excluding meat, fish, eggs and dairy, will definitely reduce saturated fat, but you run the risk of being deficient in vitamin D and B12. Vegans need to supplement these nutrients. Vitamins and minerals. The food we consume, especially fruits and vegetables, contain much of the vitamins and minerals we need to keep us healthy. We should eat at least 3 fruit a day and a lot of vegetables with our meals. Some people with arthritis prefer to cut out some foods that they believe might aggravate their arthritis. When you cut out these foods, you are missing out on the nutrients in that specific food. A good idea might be to take that nutrient in a supplement form. Vitamins are also powerful antioxidants, especially vitamin C and vitamin E. Don't make the mistake cutting out citrus and tomatoes from your arthritis diet. There is no evidence that it will relieve the symptoms of rheumatoid arthritis. This will also mean that you miss out on a vital source of vitamin C. There is quite a lot written about the benefits of taking higher levels of antioxidants in your arthritis diet. Antioxidants help to neutralize free radicals, chemicals that can damage cartilage and cause inflammation. Water. 70% of our body is water. Water forms an important part of your arthritis diet. For normal daily activities, we need about 1.5 liters of water a day. Drinking fruit juice, flavored water and herbal tea can also count as fluid. Remember that coffee and alcoholic drinks are diuretics, so you end up with an overall loss of body fluid. Contrary to what some believe, water doesn't lubricate the joints, but it does help the kidneys to flush out the toxins in the body. And excessive toxins might be linked to worse symptoms. Drinking lots of fluids is linked to a strong immune system, since nutrients are carried throughout the body by means of water. Salt. Salt is necessary to keep the correct water balance in the body. If you have hypertension problems, salt can make things worse. Most people probably eat too much salt. Do you put salt on your food without tasting it first? This can be a bad habit, since your sense of taste can adapt to less salt. More than a teaspoon of salt a day is probably too much already. Alcohol. Alcohol need not be cut out totally from the arthritis diet. 1 or 2 drinks can actually fuel the metabolism, but obviously most alcoholic drinks contain a lot of calories, so it can contribute to weight gain. Alcohol can also exacerbate the side effects of many of the medications for arthritis. Too much alcohol puts pressure on the liver to detoxify the alcohol. This is important because many of the arthritis medications also put pressure on the liver. To keep things safe, men should not drink more than 3 units of alcohol a day and 21 units a week. For women, no more than 2 units a day or 14 units a week. A unit is about 1 pint of beer or cider. A glass of wine is about 2 units. Controlling your weight. The best place to start a weight loss program is in the office of a dietitian. These professionals are trained in the latest, most healthy ways of gaining or losing weight and in selecting your arthritis diet. Avoid wasting your time and money by following diets you found in a magazine or somewhere on the internet. If a diet claims fast weight loss, you should already be cautious, because losing weight quickly is not healthy. If you lose or gain weight, you should also inform your doctor, since it might mean that your medication has to be adjusted. Overweight. This is one of the risk factors for developing or worsening your osteoarthritis. If you are overweight, it places more stress on the weight-bearing joint. More specifically, carrying more weight than you should puts pressure on the cartilage, which may be worn out already. Remember that the cartilage is only a few millimeters thick, so the pressure can grind it away so that you eventually have bone rubbing against bone. The joints in the hips and knees are especially vulnerable. Studies show that by losing just 5 kilograms over a 10-year period can reduce your risk of developing osteoarthritis by 50%. Arthritis sufferers often become inactive because of their symptoms, leading to further weight gain. Depression because of the symptoms and the outlook can also lead to compulsive eating and a lack of motivation to exercise. Being overweight also seems to make people with rheumatoid arthritis more prone to inflammation. Obesity also limits your options of having joint replacement surgery. Obese people are at greater risk for complications when receiving a general anesthetic. Besides affecting the symptoms of your arthritis, being overweight is a risk factor for diabetes, heart disease, stroke, hypertension and various types of cancer like prostate and colon cancer. If you want to lose weight, there are a few principles to discuss with your dietitian. Eat regularly. Skipping meals will make your blood sugar levels fluctuate and make you feel tired. This could also cause you to be very hungry, leading to you eating too much at once. Eat before you feel hungry. Eat about 6 small meals that fit in with your arthritis diet. This fuels your body regularly, speeding up your metabolism. A sluggish metabolism tends to go into storage mode. Cut down on sweet drinks and foods. Many foods contain hidden sugar, so read the label. Remember that fruit juice contains a lot of calories, so don't drink too much. 2 glasses a day is enough. Use a sweetener or some honey in your coffee and tea. Snack on fruit and nuts through the day. If you feel hungry between meals, rather have a handful of nuts and a fruit.